For the last 50 years, I mean literally half a century, you have probably been fed a complete lie about your morning routine.
Oh, absolutely. It's one of the biggest misconceptions out there.
Right, so imagine waking up, the alarm goes off, and before you even swing your legs over the edge of the bed, you feel it.
Yeah, that sluggish, heavy sensation.
Exactly, just sitting right in your center. You aren't hungry at all. The very concept of breakfast is, well, it's almost repulsive.
And if you're, over the age of 60, you may just sigh and resign yourself to it.
You really do. You assume that this heavy, blocked up feeling is just the mandatory toll you pay for getting older.
It becomes a tragic new normal. You accept the premise that your internal machinery is permanently set to a slower speed.
Like you just have to live with a compromised operating system. But society hates a problem without a quick fix, right? So what is your first instinct?
You shuffle into the kitchen and try to force the issue.
Yep. You brew a dangerously strong pot of dark roast coffee.
Mm-hmm.
Or, I mean, maybe you reach for one of those foil-wrapped laxative teas you keep hidden in the pantry.
Which is so common. Or, most likely, you blindly follow the single most unquestioned piece of health advice from the late 20th century.
Oh, the classic. You pour yourself a bowl of something that closely resembles shredded cardboard and tell yourself to just eat more fiber.
Right. It is the ultimate knee-jerk default setting for any digestive issue. The moment we feel backed up, the immediate societal reflex is to prescribe bulk.
But what if that deeply ingrained instinct to add more fiber is the exact mechanism making your problem exponentially worse?
Which the data strongly suggests it is.
Right. What if we've been looking at the biological mechanics of our mornings completely backward?
Uh-huh.
So today, we are taking a deep dive into an incredibly fascinating clinical breakdown regarding intestinal senescence.
And morning routines, specifically.
Yeah. This data fundamentally flips everything we thought we knew about morning digestion completely on its head.
It really does. It requires a massive paradigm shift in how we visualize our own anatomy. We have this pervasive tendency to view the human digestive tract as a crude mechanical pipe.
Like plumbing.
Exactly like plumbing. If a pipe under your sink is clogged, you shove a rigid snake down there to clear it out. You use friction and force.
Which makes sense for PVC pipes, but not human tissue.
Right. The clinical data demands that we stop treating our digestion like a plumbing emergency. We have to start treating it as a highly delicate living internal environment.
So an ecosystem.
Exactly. An ecosystem that needs to be hydrated, lubricated, and patiently restored rather than, bullied into submission.
So if the core issue is that the internal pipe is dry and the conveyor belt is broken, then shoving dry bulk down there is, well, it's sheer lunacy.
It's actively harmful.
We logically need to reevaluate the entire morning routine from the ground up. So we're going to explore exactly why fiber is acting as your enemy right now.
And we'll look at the hidden dangers and those quick fixes you currently rely on.
Yeah. Plus, we'll break down the biochemical reactions of the most common morning drinks and culminate in one surprisingly simple protocol that actually restores your body's natural rhythm.
Without a single ounce of force.
Which is the dream. So let's start with the central antagonist of this story, the traffic jam paradigm. Why does fiber suddenly fail us as we age?
Well, to understand the failure of fiber, we have to look closely at the microscopic environment of the gut as the human body passes the age of 60.
Because it's not the same gut you had at 25.
Not at all. There are two major, often entirely unnoticed physiological changes taking place in the background. The first is a significant decrease in intestinal motility.
And by motility, we mean the actual physical movement, right? Peristalsis.
Precisely. The speed and strength at which waste is physically pushed through the system by the surrounding muscles. The rhythmic, wave-like muscle contractions fundamentally lose their vigor.
So the muscles just get tired.
In a way, yes. The smooth muscle tissue in the intestinal wall becomes a bit weaker. The neurological signals from the enteric nervous system aren't quite as sharp.
So the conveyor belt is just running at a much lower voltage.
Exactly. Things sit longer. But the second biological change is perhaps even more critical, and yet it's almost entirely ignored in mainstream dietary advice.
Which is wild. What is it?
The natural, slippery mucosal layer of your intestines begins to thin out and degrade.
Okay, let's visualize this mucosal layer for a second. Because this isn't just water, right?
Oh, no, not at all. It's a highly specialized lining.
Right, it coats the inside of the intestinal walls, acting as the interface between your body and the outside world.
That's a great way to describe it. It's a viscoelastic gel. secreted by specialized goblet cells in the intestinal lining.
Goblet cells.
Yeah, think of it as the protective, lubricating barrier between your highly sensitive intestinal tissue and the increasingly dehydrated waste passing through it.
But as we age, what happens to it?
The production of those mucin proteins drops. The layer loses its moisture, its volume, and its flexibility.
Oh, wow. So it literally dries up.
The interior of the intestinal walls literally becomes drier, yes, and that causes the underlying nerve endings to become far more sensitive to pressure and stretching.
Okay, so if we connect this to the physical reality of the listener waking up with that heavy feeling, we have a slower conveyor belt, and the belt itself has lost its lubrication.
The environment is dry, sluggish, and highly sensitive.
And into this barren landscape, the standard advice tells us to introduce massive amounts of insoluble fiber.
Which is, chemically speaking, nothing more than indigestible plant bulk.
Doesn't break down at all.
No, it doesn't, and it demands water to pass.
So if your internal transport system is stopped, adding more fiber is literally like adding more cars to a traffic jam.
That's the perfect analogy. The road isn't moving.
There's zero lubrication on the asphalt. Adding 100 more cars to the highway doesn't make the traffic suddenly speed up.
It just makes the pileup longer, heavier, and more tightly packed.
That visualization hits the exact mechanical failure of the high-fiber diet for an aging gut. The problem isn't a lack of cars to push the other cars forward.
Right. The problem is that the road itself is fundamentally compromised.
I kind of look at it like a dry, dense sponge. The entire mechanism of fiber is that it absorbs ambient water to create a larger stool, right?
That's exactly how it works.
So if you take a dry, dense sponge and you shove it into a dry, unlubricated PVC pipe, it immediately absorbs whatever tiny amount of moisture is left.
It expands and gets completely lodged.
Yeah. Pushing that massive, dry object through an unlubricated space is not going to be a smooth process. It's going to cause immense friction.
Severe bloating and that awful heaviness. And crucially, pain.
Right, that dull radiating ache in your lower abdomen.
Yes. That friction against a thinning, sensitive mucosal lining triggers the stretch receptors in the intestinal wall.
Which is your body screaming in pain.
Exactly. That is what causes the heavy, distended feeling so many people wake up with. The gut absolutely does not need more bulk.
So to heal this specific environment, the clinical data indicates we must triage the tissue first.
We have to restore 3 foundational elements before we even think about moving waste.
Logically, based on the anatomy we just walked through, those 3 pillars have to be rehydrating the space, replacing that lost slime layer to reduce friction, and waking up those muscles.
But without whipping them into a violent spasm, you've outlined the exact clinical trio for restorative gut health right there.
Okay, let's break them down. First pillar.
First is hydration. But not merely drinking a glass of cold tap water, we need intracellular hydration that ensures the environment inside the colon remains soft and pliable over hours.
Got it. Deep hydration. And the second?
Natural lubrication. We must mechanically replace or chemically support that thinning mucosal layer to protect those sensitive walls from scraping.
Okay, so hydration to soften the material and lubrication to slick the walls. What's the mechanism for the third pillar?
The third is minerals, specifically the targeted application of magnesium.
Magnesium. Why that mineral specifically?
Because magnesium acts as the biological trigger to gently flip the switch for that sluggish motility. It wakes up the smooth muscle tissue.
Encouraging those wave-like contractions to return naturally.
Exactly, without using chemical force to initiate a spasm.
Okay, so hydration, lubrication, and mineral triggers.
Yeah.
If bulk fiber is actively causing traffic jams, it makes perfect sense why people instinctively turn to liquids in the morning.
Right. They feel that brick in their stomach and want to flush the system.
Yeah. So let's examine those quick fixes people reach for first, because the data breaks down exactly why these incredibly common morning habits are silently sabotaging the gut's long-term functionality.
The most ubiquitous morning liquid intervention, championed by practically every lifestyle publication, is warm lemon water.
Oh, without a doubt. It's the reigning champion of the morning routine checklist. You squeeze half a lemon into hot water, and it's supposedly this magical detoxifying kickstart.
Supposedly, yes.
Let's look at the actual biology.
Yeah.
What is happening in the stomach and the intestines when you drink that?
Well, there is a physiological reaction, but it's remarkably mild. The natural ascorbic and citric acids in the lemon act as a very low-grade stimulant.
For the stomach.
For the gastric mucosa and the vagus nerve. It basically sends a chemical signal to your body saying, you know, the fasting period is over, let's initiate the digestive cascade.
Okay, so for someone in their 20s with a perfectly functioning, highly lubricated system, that small amount of acid might be enough.
It might trigger a slight improvement in bowel movement activity, sure.
Plus, we have to admit, it's incredibly cheap, it's accessible, and just building the habit of drinking warm fluid first thing in the morning is a massive win.
Oh, absolutely. For a population that is chronically dehydrated, the sheer act of introducing warm water alone creates a sense of lightness.
The warmth helps relax tense tissue too.
That is undeniably true. But we have to look at its mechanical limitations in the context of the aging gut we just talked about.
Right, because it's not fixing the traffic jam.
Exactly. Warm lemon water does absolutely nothing to address the core degradation. It contains no mucilage to rebuild the protective layer.
No lubrication at all.
None. And it provides no osmotic minerals to mechanically draw water into the colon.
So it's like gently tapping the gas pedal on a car that has flat tires and no oil in the engine.
The engine might rev a tiny bit, but you aren't really fixing the fundamental reasons the car refuses to drive.
And the data points out a darker side to this habit if relied upon as a daily cure-all.
Yes, a significant one. The acid in lemon, when consumed day after day, year after year, aggressively degrades tooth enamel.
Oh, wow. Yeah, dentists always warn about that.
And it's a severe issue for older adults whose enamel is naturally thinning anyway, exposing the sensitive dentin underneath.
Ouch. And what about the stomach lining?
If you have a compromised, sensitive stomach lining, which goes hand in hand with a degrading intestinal mucosal layer dumping raw citric acid onto that tissue on an empty stomach every single morning, can provoke serious gastritis.
So it can actually cause more inflammation.
It certainly can.
So the takeaway on lemon water is, if you're going to do it, you must heavily dilute it with warm water. Absolutely use a straw to bypass your teeth and treat it as a gentle warm-up exercise.
Not a structural cure.
Exactly.
Okay, but let's move to the heavy artillery. Because when the gentle warm-up fails, people get incredibly desperate. The discomfort takes over.
They want results.
And they want them by tomorrow morning at the latest. Enter the foil-wrapped savior Senna laxative tea.
Ah, Senna. This represents a complete departure from biological encouragement. This is where we transition into the absolute chemical coercion of the human digestive system.
Okay, I want to push back on this framing just a little bit to represent the person listening who relies on this, because the data clearly acknowledges that Senna tea will clear you out overnight.
It will, undoubtedly.
Right. If you haven't had a proper movement in 4 days, you feel toxic, your clothes don't fit right, and you drink this tea the next morning, the blockage is completely gone. You feel empty.
Which feels like release. Exactly. From a pure results standpoint, isn't that a massive success? Why is fast, guaranteed relief framed as a biological drawback?
It's a totally rational question, and the answer hinges on the vital difference between evacuation and restoration.
Okay, walk me through that.
We have to look at the exact mechanism of action. Senna leaves contain active compounds called senosides.
Senosides, okay.
When these compounds reach the bacteria in your colon, they are metabolized into highly active, irritating chemicals.
Irritating, like they purposefully agitate the gut.
Yes. They directly attack the intestinal walls, severely irritating the tissue to force the smooth muscles to contract violently.
Oh, wow.
It triggers harsh, rapid, panic-induced spasms to expel the irritant.
You know that sudden cold sweat panic you get in your lower stomach right before it hits? That's not your digestion smoothly waking up.
No, not at all. That is your smooth muscle tissue being chemically forced into a defensive spasm.
It forces the conveyor belt to move at maximum speed, regardless of whether the belt is lubricated or if the road is clear.
Precisely. And because it's forcing a panicked evacuation, the localized side effects are severe cramping, radiating abdominal pain, and a very sudden, uncontrollable urgency.
And remember the environment we're dealing with. We're talking about an aging gut where the protective mucosal lining is already thin and sensitive.
Subjecting that raw, unlubricated environment to intense, chemically induced spasms is nothing short of traumatic to the cellular tissue.
But the real danger isn't just surviving a morning of cramps, is it? It's what happens to the neurological and muscular system long term.
The primary devastating danger is muscular dependency.
Dependency, like your gut gets addicted to it.
Essentially, yes. The smooth muscle in your intestines is designed to work rhythmically and autonomously. It relies on internal pacemakers and gentle stretching to know when to move.
Right.
When you constantly override that natural, subtle system with overwhelming chemical stimulants like Senna, the enteric nervous system effectively gives up.
The gut forgets how to move on its own.
It downregulates its own natural motility because it becomes reliant on the external chemical trigger.
So by forcing an evacuation today, you are actively dismantling your body's biological ability to ever have a natural movement tomorrow.
You are trading today's immediate discomfort for a permanent structural dependency.
That is terrifying.
Over time, your baseline motility drops so low that you will require higher and higher doses of senna just to achieve the same initial effect.
The clinical consensus is explicitly clear on this, right? Stimulant laxatives like senna are strictly short-term emergency tools.
We are talking 2 to 3 days maximum to clear an acute impaction. It is not a daily morning habit.
Clearing a traffic jam by indiscriminately blowing up the cars with dynamite leaves you with a destroyed highway. That is not restoration.
That is destruction.
Okay, the picture is incredibly clear. The traffic is jammed. Adding fiber just adds more cars to the pileup. Lemon water is too weak to fix the asphalt.
And senna tea calls in an airstrike that rips up the road.
Exactly. We desperately need an intervention that heals the raw tissue rather than bullying it into submission. And this leads us to a category of interventions that, I have to admit, sound texturally challenging.
They do, yes.
But structurally, they act as a vital soothing balm for a dry gut. We are moving away from aggressive stimulation and diving into gentle mucosal repairing options.
This is where we focus heavily on the second pillar we establish, natural lubrication.
If the tissue is raw and dry, we must triage the friction.
And the first biological intervention analyzed here is overnight okra water.
Okay, we have to talk about the sheer sensory reality of this. We're talking about asking the listener to drink what essentially amounts to plant slime first thing in the morning on an empty stomach.
Yes, plant slime is an accurate, if unappealing, description.
The protocol dictates that you slice 3 to 4 fresh okra pods lengthwise, submerge them in a glass of room temperature water, and let it sit overnight. By morning, the water is saturated with natural mucilage.
It is a thick, viscous, slippery gel.
Is swallowing this sensory hurdle really worth the trade-off?
It is entirely understandable to hesitate at the texture. Modern diets have largely eliminated mucilaginous foods, but what is absolutely fascinating here is the biology of physiological mimicry.
Mimicry, like it's copying something the body already does.
Exactly. We discussed how the root cause of the discomfort is the degradation of the gut's natural mucosal layer.
A natural slime.
Right. Chemically and physically, human mucin is a slippery, gel-like substance made of long-chain glycoproteins that trap water.
So the plant mucilage from the okra is literally acting as a pre-made replacement part for the body's own lost fluids.
It is functionally identical to the natural barrier your aging gut is struggling to produce.
That is incredible.
Okra mucilage is packed with complex polysaccharides that hold onto water molecules, creating that viscous texture. When you drink that okra water, that thick, slippery gel travels down and coats the intestinal walls.
It acts as a mechanical replacement, a liquid cast, if you will.
It drastically reduces the friction coefficient, allowing dry, static waste to glide over the sensitive tissue instead of dragging and scraping against it.
You're manually relubricating the dry pipe we talked about earlier. You are laying down the asphalt so the cars can actually move.
And its benefits extend far beyond just mechanical lubrication.
Oh, really?
What else does it do? Research indicates that these natural plant mucilages can actually bind to and soothe irritated tissue, reducing localized markers of inflammation in the gut over time.
Wow, so it actually heals the tissue.
Yes. By providing that temporary protective shield, you are giving the sensitive, dry tissue beneath it the biological peace and quiet it needs to heal, free from the constant micro-trauma of unlubricated digestion.
It's incredibly gentle. There are no chemically forced spasms, no airstrikes, just a slow, steady recoating of the internal environment.
It's restorative.
But we have to be realistic here. If a listener simply cannot stomach the texture of okra water, and frankly, keeping fresh okra in the fridge every week requires a level of consistency some won't maintain, there is an alternative.
Yes, there is a secondary combination that achieves a remarkably similar soothing effect. It comes in powder and juice form.
Aloe vera and slippery elm.
This is a highly sophisticated combination because it tackles the tissue degradation from two synergistic angles.
Okay, let's break it down. Start with the slippery elm.
Slippery elm bark, when finely powdered and mixed with hot water, does exactly what its name implies. It undergoes a process called hydration swelling.
Forming a thick, protective mucilage.
Yes, it behaves very similarly to the okra gel, providing that immediate, temporary physical barrier over the raw gut lining.
So the slippery elm acts as the liquid bandage. It covers the wound.
Exactly. But then, into that soothing elm gel, you introduce pure inner leaf aloe vera juice.
And what does the aloe do?
Aloe vera contains powerful bioactive compounds, most notably a complex carbohydrate called ace-mannan. These compounds go far beyond mechanical protection.
They do active work.
Yes, they actively interact with the cellular receptors in the intestinal lining to support regeneration and modulate the immune response.
So if the slippery elm is the protective bandage, the aloe vera acts as the active medicinal ointment trapped underneath that bandage.
That's a perfect analogy, actively promoting cellular healing and turning down the heat on inflammation.
Clinical studies on aloe-derived polysaccharides indicate they can significantly improve the tight junctions of the gut barrier too.
Right. As we age, and as inflammation persists, that cellular barrier weakens, a condition often referred to colloquially as leaky gut.
Which allows unwanted microscopic particles to pass through the intestinal wall into the bloodstream.
Triggering systemic fatigue and inflammation, this elm and aloe combination physically tightens and repairs that barrier.
The data notes that individuals using this protocol report a noticeably calmer stomach, a massive reduction in morning bloating, and a slow, steady return to regular movements without any sense of panic or force.
It soothes the environment first, and normal function returns as a byproduct of that healing.
But as with all powerful biological interventions, there are crucial caveats. Slippery elm has a distinctly earthy, woody taste.
It's not for everyone.
And the texture is still gel-like, which is a hurdle. And there's a very severe non-negotiable warning regarding the aloe vera.
Yes, this is paramount for anyone managing chronic conditions. Aloe vera contains compounds that can alter the absorption rates of certain pharmaceuticals.
And it has a mild blood-thinning effect, right?
It does. It is absolutely critical to consult with a physician or a clinical pharmacist before introducing daily aloe vera into your routine if you are on anticoagulant medications, diabetes drugs, or any strict pharmaceutical protocol.
Please always consult your doctor before acting as your own pharmacist. But assuming you are cleared, the daily protocol is pretty simple.
You mix a small teaspoon of slippery elm powder with hot water, let it sit for 10 minutes to fully express the gel, stir in an ounce of the aloe juice, and drink it warm about 15 to 20 minutes before breakfast.
It's not a fast-acting overnight flush like Senna. It's the gradual, sustainable reconstruction of your internal ecosystem.
Which is exactly what a depleted, aging system fundamentally requires to function long-term.
So we've explored options that directly hydrate the space and manually lubricate the intestinal walls with mucilage. But what if we could make the digestive workload vastly easier before the food even reaches the colon?
Let's travel upstream.
Because the clinical data outlines a method to radically improve the input quality, ensuring that the output downstream basically takes care of itself.
And it involves a compound that has sparked an exhausting amount of internet debate.
Apple cider vinegar.
Specifically, raw, unfiltered, diluted apple cider vinegar.
And you're entirely correct. The miraculous claims surrounding ACV in popular media are often wildly exaggerated and scientifically baseless.
Oh, the internet makes it sound like magic. It's not. However, when we strip away the hype and view it strictly through the lens of gastric mechanics and enzymatic cascades, there is a profoundly sound biological rationale for its use.
Okay, so the protocol suggests taking 1 single teaspoon of raw apple cider vinegar, heavily diluting it in a large glass of warm water, perhaps adding a touch of honey to soften the acidic bite, and consuming it 15 to 20 minutes before your first meal.
That's the method.
Now, to the layman, if the traffic jam is happening down in the colon, how does drinking vinegar into the stomach actually resolve a sluggish bowel movement?
It all comes down to the power of acetic acid and the biological chain reaction of digestion. As the human body ages, the parietal cells in the stomach often become less efficient at producing hydrochloric acid.
Which is stomach acid.
Right. This condition, known as hypochlorhydria, means the stomach environment is not acidic enough to properly break down proteins or trigger the next phase of digestion.
So the food just sits there, partially undigested.
Exactly. The acetic acid in the vinegar safely lowers the gastric pH, artificially restoring that highly acidic environment. When the stomach pH is optimal, the mechanical and chemical breakdown of food is far more thorough.
I always explain this using a restaurant kitchen analogy. The stomach is the prep station.
I love this analogy.
If you have a highly skilled prep cook who chops, marinates, and prepares all the raw ingredients perfectly upstream, then when those ingredients are passed down the line to the chefs, which in our body's case would be the trillions of intestinal bacteria, They don't have to struggle.
The meal comes together effortlessly.
Right.
That analogy perfectly captures the enzymatic handoff. Digestion doesn't truly happen in the stomach. Absorption happens in the small intestine and fermentation in the large intestine.
So if the stomach fails to properly liquefy the food, you're sending complex, uncleaved proteins and poorly broken down carbohydrates into the lower intestines.
And the small intestine panics. The bacteria in the colon are forced to feast on raw material. This causes aggressive fermentation, massive gas production, severe bloating, and it feeds pathogenic bacteria while starving the beneficial ones.
But by using ACV to ensure the input is clean and fully processed upstream, the beneficial bacteria downstream can easily manage it.
And here is the crucial physiological payoff. A healthy, balanced fermentation process by good bacteria produces short-chain fatty acids like butyrate.
Butyrate. And what does butyrate do?
It naturally stimulates smooth muscle contractions and promotes healthy bowel movements.
Wow. So it's an entirely indirect fix. You aren't forcing the colon to move at all. You're simply providing the downstream bacteria with the perfect, easy-to-manage material so that the colon naturally wants to do its job.
You are removing the burden from the exhausted system.
You're fixing the assembly line at step 1 rather than trying to hammer the broken product at step 10.
Exactly. But similar to the warm lemon water, ACV is an acid and must be handled with strict clinical care.
Right, the data is uncompromising on this. Do not take this casually and never drink it straight.
If it's too concentrated, it literally burns the esophageal lining.
It can severely upset a sensitive stomach, and if you have a clinical history of severe acid reflux, GERD, or gastric ulcers, introducing exogenous acid might be a terrible, painful idea for you.
Plus, the acidity will aggressively dissolve your tooth enamel if you let it wash over your teeth.
So extreme dilution is biologically necessary. 1 teaspoon in 8 to 10 ounces of water. And again, drinking it exclusively through a glass or stainless steel straw, placing the tip past the teeth, is highly recommended.
It is a subtle upstream shift. But for many individuals, perfecting the gastric breakdown permanently resolves the downstream traffic jam over the course of a few weeks.
So we have thoroughly discussed options that hydrate. We have explored options that lubricate using plant mucilage. And we have detailed options that improve upstream enzymatic digestion.
But the data culminates in one final, elegant protocol.
A recipe that seamlessly combines the crucial trio we established at the very beginning of this deep dive: intracellular hydration, mucosal lubrication, and gentle mineral motility into a single, highly effective glass.
The clinical breakdown ranks this as the ultimate foundational choice.
Yes. The absolute pinnacle of these morning interventions, the one that perfectly aligns with the biology of an aging gut, is a combination of magnesium-rich mineral water and soaked chia seeds.
It is incredibly powerful.
The recipe is deceptively simple. You take 1 tablespoon of whole chia seeds, add them to a tall glass of high-quality, magnesium-rich mineral water, stir it vigorously to prevent clumping, and leave it in the refrigerator to soak overnight.
In the morning, you stir the suspended gel once more, let it come to room temperature, and drink it 20 minutes before breakfast.
Why does the data crown this specific combination as the absolute gold standard?
Because it operates on a brilliant dual-action mechanism that perfectly mimics and supports the body's natural physiology without introducing a single element of force or irritation.
Let's break down the biochemistry, starting with the liquid base, the magnesium.
Right. We explicitly named magnesium as the third pillar of restoration earlier, the mineral trigger.
Magnesium, particularly when dissolved in mineral water for high bioavailability, acts as a powerful osmotic agent in the bowel.
When this magnesium-rich fluid enters the colon, it alters the chemical gradient.
Osmosis, right? It draws water in.
Yes. It actively draws ambient water from the surrounding bodily tissues across the intestinal epithelium and into the colon space.
Which directly and continuously achieves our first goal. It deeply hydrates and softens the hardened waste material, making it pliable and easy to pass.
But the magnesium also interacts directly with the muscle tissue.
Right. Let's contrast this mechanism with the violent senna tea we broke down earlier. It's fascinating because senna acts by forcing harsh, panicked muscle spasms.
But magnesium functions in the exact opposite manner on a cellular level.
It acts as a relaxant.
It does the exact opposite of senna. Magnesium is a natural calcium channel blocker in smooth muscle tissue. In order for a muscle to contract, calcium must rush into the cell. Magnesium blocks that rush, acting as a profound relaxant.
Instead of shocking the gut walls into a defensive spasm, the magnesium soothes and relaxes the tense, cramped tissue.
When the smooth muscles are finally relaxed, They're able to reset and resume their natural wave-like peristalsis without any strain, pain, or sudden urgency.
It essentially resets the neurological pacemaker of the gut. So the magnesium effortlessly pulls the water into the colon to soften the concrete, and it actively relaxes the tense, aching walls so the natural conveyor belt can start moving smoothly again.
That elegantly covers the hydration and motility pillars.
What's the biological role of the chia seeds?
The chia seeds are the ultimate, easily accessible source of natural lubrication.
When a chia seed soaks in water overnight, it undergoes a profound structural transformation, doesn't it?
It really does. The outer hull of the seed is packed with specialized soluble fiber. Over 8 hours, they absorb up to 12 times their weight in water, exuding a massive, thick layer of mucilaginous gel around each individual seed.
It's that mucilage again, just like the okra and the slippery elm, but suspended in a drinkable liquid.
Exactly. But unlike okra, which can be inconsistent, chia provides a highly dense, uniform gel matrix. This chia gel perfectly mimics the thinning mucosal layer of the aging intestines,
As you drink it, millions of these tiny gel-coated seeds travel through the digestive tract.
laying down a continuous, slippery, protective coating over the raw tissue, drastically reducing the friction coefficient of the entire system.
So in one single, incredibly simple morning glass, you're getting the water actively pulled into the colon by the osmotic power of the magnesium. You're getting the thick, slippery gel cast provided by the chia seeds to protect the walls from friction.
And you are getting the gentle, cellular level relaxing trigger for muscle movement from the mineral itself.
It ticks all three boxes: hydration, lubrication, minerals, without forcing a single unnatural contraction.
And as an added systemic benefit, magnesium is a critical cofactor in over 300 enzymatic reactions in the human body.
300, wow.
It's crucial for regulating blood pressure, synthesizing proteins, and calming the central nervous system. You are brilliantly addressing the localized digestive failure while simultaneously providing a fundamental, often deficient nutrient for your overall cellular health.
It sounds incredibly elegant, a perfectly balanced biological solution. But as anyone who has ever tried to change a habit knows, knowing the recipe is the easy part.
Human nature usually finds a spectacular way to ruin a good thing by either rushing it, overcomplicating it, or losing patience.
Yeah, the clinical breakdown spends a significant amount of time detailing the critical behavioral mistakes people make when trying to implement these restorative routines.
Let's look at how to actually use this information in the real world, because mixing the drink correctly is only half the battle.
The data outlines 3 fatal errors in implementation that virtually guarantee failure. The first is what we can classify as the more is better fallacy.
Oh, the classic American consumer mindset.
If one thing is good for me, then combining 5 things must make me invincible.
Precisely. People will absorb this information, get overly enthusiastic, and decide to mix the apple cider vinegar, the okra mucilage, the aloe vera juice, and the chia seeds all into one massive, chaotic morning cocktail.
Thinking they are biohacking their way to the ultimate immediate super cure.
But biologically, what they're actually doing is completely overwhelming a highly sensitive, already structurally compromised ecosystem.
The aging gut absolutely does not need more complex stimulation.
No, it needs targeted, single-variable support and the time to adapt to it.
Throwing 5 different mechanisms of action acids, expanding fibers, osmotic minerals, and cellular modulators at it simultaneously will almost certainly lead to severe gastric confusion, massive bloating, and intense cramping.
The biological protocol demands absolute simplicity. Choose one solid foundation, like the magnesium and chia protocol, and stick to it exclusively. Let the body adapt.
Okay, mistake number 1, overloading a fragile system. Mistake number 2 is where I think we are going to lose a lot of people, but it is biologically undeniable.
This is a tough one.
The protocol specifically and sternly warns against drinking coffee immediately after consuming any of these mucilage drinks.
Telling a chronically fatigued population that they have to delay their morning coffee is going to cause a riot.
It is. Let's break down the exact mechanism. Why does a cup of coffee ruin the restorative protocol?
It comes down to transit time, the gastrocolic reflex, and the specific mechanical purpose of the gels we just spent so much time discussing.
Okay.
Coffee, specifically the high concentration of caffeine combined with the hot temperature, acts as a rapid, powerful neurostimulant for the digestive tract.
It instantly triggers the gastrocolic reflex, which dramatically and artificially speeds up intestinal motility.
Which, to the listener who feels backed up, sounds like a fantastic thing, right?
Speed it up.
In a vacuum, sure. But you must consider the biological sequence of events you just initiated. You have just consumed a highly specialized, soothing gel, whether it's the chia mucilage, the okra water, or the slippery elm.
The entire singular purpose of that gel is to slowly transit the system, adhere to the intestinal walls, provide a lasting physical barrier, hydrate the dry tissue through contact time, and allow the magnesium a window to absorb and relax the muscles.
The mucilage desperately needs time to lay down the liquid cast. It needs minutes and hours of contact to soothe the raw tissue.
Exactly. If you drink that delicate, slow-moving gel, and then 5 minutes later you immediately flood your stomach with a powerful, hot stimulant like caffeinated coffee, you hit the physiological fast-forward button on your entire digestive tract.
The gel matrix is rapidly and aggressively flushed through the system before it has any opportunity whatsoever to adhere to the walls, provide friction relief, or facilitate cellular healing.
You essentially wash the highly specialized medicine right down the drain before it can act on the wound.
You get the immediate stimulant-induced speed from the coffee, but you completely sacrifice all of the restorative mucosal healing.
You're right back to forcing the system with a stimulant instead of repairing the foundation.
Biological consistency and patience are strictly required here. You must respect the transit time. You have to give the supportive mucilage compounds the quiet time they need to physically interact with the degraded intestinal lining.
So the practical application is this. Drink your magnesium chia water the moment you wake up. Then go take a warm shower, get dressed, read the morning news, walk the dog, and give the gel at least 30 to 45 minutes to clear the stomach and coat the intestines before you even think about brewing that first cup of coffee.
You don't have to quit coffee, you just have to respect the biological sequence.
That makes perfect sense, even if it requires a slight, annoying shift in your morning routine. What's the third and final mistake?
Quitting the protocol prematurely. The data highlights a highly predictable behavioral pattern.
Many people will try these gentle, restorative methods for 2 or maybe 3 days.
And when they don't experience a massive, immediate Senna-like evacuation on Tuesday morning, they loudly declare the biological method a failure and give up, retreating straight back to the laxatives.
They're psychologically addicted to the violent bulldozer. They equate severe cramping with success.
They're addicted to the immediate, forceful reaction, confusing trauma with efficacy. But rebuilding a degraded internal environment is not a singular event. It's a slow biological process.
It takes time for a desiccated mucosal lining to capture water and rehydrate.
It takes days for the smooth muscles to regain their natural tone and rhythm after being suppressed by months or years of harsh chemical laxatives.
Which is exactly why this deep dive culminates in a specific, measurable action plan, the 7-day protocol.
We challenge you to stick to just the magnesium mineral and chia seed water every single morning for one full, uninterrupted week.
No mixing 5 different remedies, no immediate coffee chaser, and absolutely no giving up in frustration on day 3.
Just observe your biology. Monitor the subtle return of lightness, the slow reduction in painful afternoon bloating, and the gentle, unforced return of your body's natural peristaltic rhythm.
It's a fundamental challenge of choosing biological consistency over chemical intensity. You're transitioning from a demolition mindset to a restorative one.
Exactly.
Okay, let's pull all of this together and recap the massive paradigm shift we've explored today. If you are waking up feeling sluggish, heavy, and dreading the physical sensation of your morning, it's not necessarily a permanent, inescapable life sentence of aging.
And it is absolutely not a sign that you just need to force down another massive bowl of dry, expanding bran flakes.
The core realization you must internalize is that your internal environment has fundamentally changed over the decades.
The pipeline has lost its localized moisture, its specialized mucosal protection has thinned out, and the smooth muscles lack their natural mineral trigger.
Adding dry fiber to a dry, unlubricated pipe is just adding more cars to a miles-long traffic jam.
Using harsh Senna tea is bullying a raw, sensitive system with chemical airstrikes and guaranteeing long-term muscular dependency.
Instead, we have to leverage the brilliant biology of physiological mimicry. We use the specialized mucilage in okra, aloe, or chia seeds to perfectly replace the lost mucosal gel layer, soothing the raw tissue.
We use targeted magnesium to gently pull in water through osmosis and relax the smooth muscles.
We must stop treating the gut like a clogged mechanical drain that needs to be violently plunged, and start treating it like a complex living ecosystem that needs to be patiently watered and tended.
If we pull back and connect this hyper-specific biological lesson to the bigger picture of how we operate, I think it leaves us with a rather profound philosophical takeaway.
Surely.
Consider how modern life conditions us to constantly reach for the sanity equivalent in virtually all aspects of our existence.
Explain that. What do you mean by the sanity equivalent in life?
Well, whether we're looking at our physical health, our professional work, or our personal relationships, we're culturally obsessed with forceful overnight fixes.
Oh, I see what you mean. We constantly demand the aggressive shortcut that forces an immediate, visible result today, even if we know that shortcut, quietly, structurally destroys our foundation over time.
We rely on the harsh stimulants of stress, anxiety, and panic to motivate us at work, much like relying on a chemical laxative to force our digestion. We use explosive force to clear the immediate blockage, but we leave the underlying ecosystem completely raw and exhausted.
Wow. We build a deeply ingrained dependency on the immediate crisis rather than doing the slow, unglamorous, quiet work of building a healthy, self-sustaining system. We prefer the bulldozer over tending the garden.
Exactly. So the vital question this leaves us with is this. What other traffic jams in your life are you currently trying to fix by just aggressively adding more cars or bringing in a bulldozer to force an outcome instead of taking the patient, gentle time to repair the road itself?
That is a phenomenal, necessary question to leave on. Thank you so much for joining us on this deep dive into the fascinating mechanics of your own body. Try the 7-day protocol with the magnesium and shea. Give your internal ecosystem the patience and lubrication it desperately deserves. Until next time, we genuinely hope tomorrow morning feels just a little bit lighter and a lot more natural for you.